Lesson 3 deals with disturbances of growth and neoplasia. Disturbances of growth are pathologic processes that result in a change in size of the affected organ or tissue. In some instances, the increase in the size or volume of an organ is the result of enlargement of the existing cells, that is, no new cellular elements are added. In other instances, the increase reflects the formation and growth of new cells of that particular organ. The first of the disturbances of growth is hypertrophy. Hypertrophy designates a general increase in the size of an organ or a part due to an increase in the size of existing cells. No new cellular elements are added. Hypertrophy of cells and organs occurs in a variety of physiologic and pathologic conditions. For example, skeletal muscle will enlarge or hypertrophy as a result of exercise. Heart muscle will hypertrophy or enlarge in persons who have high blood pressure. There is an increased demand on the heart muscle so that it greatly increases in size and weight to compensate. When one kidney has been seriously damaged by disease or perhaps surgically removed, the remaining kidney becomes considerably enlarged, representing compensatory hypertrophy. Within a relatively short time, perhaps as little as 3 or 4 months, the remaining kidney will have practically doubled its weight, becoming as large as both kidneys were originally. Examining such a kidney microscopically will disclose that there is no increase in the number of nephrons, but each nephron is approximately twice as large as normal. Another example is during pregnancy, when normal physiologic hypertrophy of the uterus occurs. It should be emphasized at this point that if the increased size of a tissue or an organ is the result of fatty infiltration, or if the enlargement is due to retained secretions or hemorrhage, the term hypertrophy is not applied. The increase in size has to represent an increase in the size of the individual units of the organ. The next growth process disturbance is hyperplasia. Hyperplasia refers to an increase in the size of the organ or tissue caused by the formation of new cells. Hyperplasia occurs in a number of situations which may or may not be related to disease. Number 1, it occurs in endocrine glands when there are increased needs for the hormones which are produced by these glands. A second example occurs in the lymph nodes during an infection. All of us have experienced at one time or another a severe sore throat or tonsillitis, which resulted in the lymph nodes in the neck becoming enlarged and tender to palpation. The enlargement of these lymph nodes is due to hyperplasia. The lymph nodes are attempting to produce many new lymphocytes to help fight the infectious process. In the oral cavity, hyperplasia occurs around the margins of ill-fitting dentures. Occasionally, scar tissue undergoes marked hyperplasia in certain individuals. This hyperplasia of scar tissue, termed keloid, occurs predominantly in darker complexioned persons. This is basically a hyperplasia of scar tissue. Increased size of an organ or tissue can result from a mixture of hypertrophy and hyperplasia. For example, enlargement of the breasts during the menstrual cycle involves both processes and, of course, is under hormonal control. The next portion of the lesson deals with neoplasia or tumor growth. A neoplasm is defined as a new growth which arises from the individual's body cells. It differs from hyperplasia, hypertrophy, or the type of growth in an unborn baby in that the neoplastic growth is not purposeful and has no expected end point. The terms tumor and neoplasm are not synonymous. Tumor is a general term indicating a swelling or growth. Neoplasm is a more specific term, although in practice the two terms are used interchangeably. Malignant neoplasms are usually termed cancer. This terminology is used for any malignant neoplasm and does not indicate a specific type of malignancy. Neoplasms are designated as benign or malignant on the basis of their expected clinical behavior. Benign neoplasms remain localized, generally grow slowly by expansion, and are generally not a threat to the life of the host. There are exceptions, of course, such as those benign neoplasms that are situated in vital positions. Malignant neoplasms, on the other hand, grow rapidly and enlarge predominantly by infiltration or invasion of surrounding tissues, eventually destroying them. In addition, malignant neoplasms have a capacity to invade blood vessels and lymphatic vessels. After invading these vascular channels, tumor cells may become dislodged and carried to areas distant from the site of the original tumor. This process is known as metastasis. Unless effectively treated, malignant neoplasms interfere with the health and will eventually cause the death of the patient. The next portion of the lesson deals with how neoplasms are classified and named. Neoplasms in general are named by the origin of the neoplastic cells. The suffix OMA is added if the neoplasm is benign. For example, if a benign neoplasm arises from fibrous connective tissue, it is termed a fibroma. Carcinoma is added as a suffix if the malignant neoplasm is of epithelial origin. For example, any malignant tumor that arises from the epithelium of the skin or epithelium lining the oral cavity is termed a carcinoma. If this neoplasm arises from squamous epithelium, it is termed a squamous cell carcinoma. The suffix sarcoma is added if the malignant neoplasm arises from mesenchymal or connective tissue origin. For example, a malignant tumor of bone is termed osteosarcoma. The classification of neoplasms is essential not only for teaching, but also for communication between physicians treating patients and between investigators in the field of neoplasia. This classification is known as the histogenetic classification. That is, the neoplasms are named after the known or assumed origin of the neoplastic cells. The next portion of the lesson deals with general behavior and appearance of benign neoplasms. Benign neoplasms are generally rounded or ovoid. Usually a benign neoplasm has a capsule formed by compression of adjacent connective tissues. Under the microscope, the cells comprising a benign neoplasm resemble very closely those of the parent tissue. The effects of a benign neoplasm are produced chiefly by its location. For example, a benign fibroma arising in the cheek within the oral cavity produces its effects as an irritating mass. Some benign neoplasms can be of tremendous size with no effect on function. On the other hand, a small benign neoplasm situated within the spinal cord may produce paralysis because of its location. The next portion covers the general behavior and appearance of malignant neoplasms. Malignant neoplasms differ from benign neoplasms by their ability to invade adjacent tissue and by their ability to metastasize. The malignant tumor is usually not encapsulated, and finger-like projections of the neoplasm extend into adjacent tissue. The tumor grows by infiltration and destruction of the adjacent tissue that it invades. For example, a squamous cell carcinoma of the gingival tissues in the oral cavity will invade the underlying connective tissue and the bone of the jaw. Malignant neoplasms are also characterized by the spread of tumor cells to sites distant from the primary lesion. This again is metastasis. Neoplasms that arise from glandular tissue have a slightly modified terminology. Benign neoplasms of glandular origin are termed adenomas. Appropriate examples include adenomas of the salivary glands, adenomas of the thyroid, and adenomas of the female breast. Malignant neoplasms of glandular origin are termed adenocarcinomas. They are termed carcinomas because most of the active functioning tissue in the gland is of epithelial origin. Appropriate examples again would be an adenocarcinoma of the breast, adenocarcinoma of the glands of the stomach, or an adenocarcinoma of the thyroid gland. Recall that metastasis is the spread of neoplastic cells distant from the site of the original growth. Metastases are brought about in several ways. One way is the invasion of lymphatic channels by malignant cells and the resulting separation of a group of these cells, which are then carried to other parts of the body. At these new locations, the cells begin to grow and enlarge. A second way in which metastasis occurs is when malignant neoplastic cells invade blood vascular channels, with the result that some cells break off and are carried by the blood system to new locations. A third way in which metastasis occurs is by direct extension. Crab-like extensions of the tumor will invade surrounding or underlying tissues. An example given previously was a squamous cell carcinoma of the gingiva, which invaded the underlying tissues and bone of the jaw. A fourth means of metastasis is by mechanical transfer of neoplastic cells. This can occur during a surgical procedure if the surgeon accidentally spills some of the malignant cells at the time of operation. Certain malignant neoplasms tend to favor metastasis by certain routes. For example, sarcomas tend to metastasize by way of the bloodstream. On the other hand, carcinomas tend to metastasize first by way of the lymphatic system. These are not arbitrary rules, however, because some sarcomas will metastasize by gaining access to the lymphatic system, and conversely, some carcinomas will invade the blood vascular route as their means of metastasis. An example of a metastatic lesion is seen here. This shows a squamous cell carcinoma arising on the tongue. And here is an enlarged lymph node in the neck of the patient, the site of metastasis. Any type of therapy employed in treating cancer must deal not only with the primary lesion, but also with the sites of metastasis. For example, surgical removal of the squamous cell carcinoma of the tongue would also have to entail surgical removal of the lymph nodes in the neck. Surgical removal of an adenocarcinoma of the female breast usually entails removal of the adjacent lymph nodes situated in the underarm area. The next unit in this lesson deals with the causation of cancer. The term carcinogenesis is usually applied to this concept. Although many factors associated with the development of cancer have been described, the ultimate cause in most cases is not known. There are several hypotheses relating to carcinogenesis. The first hypothesis is the factor of physical irritation and trauma. Irritation is probably not a significant factor unless the irritant has some special cancer-producing qualities. Examples of some of these known irritants are, first, coal tars, certain aniline dyes, and chronic exposure to excessive amounts of X-ray radiation. In addition, persons exposed to sunlight over a long period of time, such as farmers or sailors or persons who work outdoors, develop senile changes in the skin prematurely. These changes involve the exposed parts of the body, such as the face, the lower lip, the back of the neck, and the back of the hands. It is known that these people who suffer this chronic exposure to sunlight have a greater tendency to develop skin cancers than persons who are not so exposed. Another important hypothesis is that viruses or some other infective agent may be the cause of cancers. As of yet, there is no proof that any human cancer is caused by a virus. However, some neoplasms in animals are known to be viral-caused. The viral theory proposes that the viral particles cause a change in the genes and chromosomes of the body's cells. This change is irreversible and persists in all the daughter cells of those that had been infected by the virus. The third hypothesis relating to carcinogenesis is that certain chemical agents may be responsible for the development of cancer. These chemicals are known as carcinogenic agents. It is known that persons who work in industries associated with the manufacture of certain chemicals and insecticides have a higher incidence of some cancers than persons who are not exposed to these chemicals. For example, persons working with anthracene and creosote develop cancer of the hands and arms. Persons handling insecticides containing arsenic have a higher incidence of skin cancer. Cancer of the urinary bladder is prevalent in persons who work in certain dye industries. Of course, tobacco is responsible for a great number of human cancer cases. This applies to lung cancer and to cancer of the mouth. To recapitulate some of the concepts of malignant neoplasia, cancer begins when a normal cell is transformed into a cell which is no longer like the others with which it has existed. Instead of responding to the bodily regulations which keep the other cells functioning, as part of the lung or breast or muscle, for example, the transformed cell is somehow freed of that response. Instead of ceasing to multiply as the other cells in the bone or breast or lung have done, this cell begins to multiply anew without restraint. Soon the multiplying cancer cells form a tissue of their own and invade the surrounding normal tissue, competing with it for blood supply and nutrients. Ultimately, in its unceasing growth, cancer disrupts the functioning of the organ it invades and destroys it. This ends Lesson 3.